So after using the Isolite for a couple weeks now, we definitely have some funny stories about our first times using it. And I think that's the point. You have to be a little bit patient with yourself, patient with your staff a little bit. It was hard to even know how to talk to patients about it. We got some really great bullet points from Isolite about how to describe what this thing is. I think one of the main things is to make sure you're talking about the features and benefits to the patient, that it makes it a little bit easier to stay open, keeps them from gagging on stuff. So that was one thing there, is just even introducing it to the patients. And I think that is going to get better as we get better about talking about it. The other part of it is that with the control head coming out the side of the mouth, I realized I had to put my hand in a little bit different position. I couldn't just kind of do things the way I was doing before. And it wasn't a crazy changeover, but once I kind of got used to, okay, this control head's here, then I knew where I needed to go. But the main thing is that all of a sudden it's like, whoa, I can actually see, with almost as good a retraction or better than a rubber dam. Nobody likes a rubber dam. Patients don't like the rubber dam. Every dentist I know doesn't like to actually place it on anybody. And this gave me great retraction so I could fully see what we were doing. We were able to see better simply because the entire oral cavity is completely lit up. And then even using it with things like our digital impressions, there was no worry about the tongue getting in the way or cheek in the way. We got a really nice, clear digital impression. So far, so good. We've been liking it a lot, and it seems like patients are really responding to it.
So today I came in for a crown. It was the first time having a crown with Dr. Jeff Rohde, my previous dentist that I had to do this procedure with. The process was long. It was complicated, and it just felt very uncomfortable in my mouth with all of the hands getting in there and the suction and whatnot. And today with Dr. Rohde's practice, they have this new thing called an Isolite, and it was really neat how, by putting it in my mouth, I was able to just relax, sit there. They were in and out doing the entire crown procedure relatively quickly, and it was very comfortable, and it was quite an enjoyable experience.